Koda TV, reconciling humanity to the source. Stay blessed.
Partner.
Okay, I've also heard that there is something called the long use of combined hormone therapies.
Yes.
And my understanding was the use of something like certain family planning medications and stuff like that. Is that what that is?
Yes. So we, as medical professionals, we always say that if you want to go on a family planning schedule, you should speak to your health professional, because the use of contraceptives also put you at a risk of developing certain cancers. So don't just go to the pharmacist and just get any contraceptives and start using it, because your risk of developing cancer could be high. It is always good to plan with your health professional. Seek advice from your midwife. Seek advice from your GP. And equally, you should also know that your lifestyles, like the use of taking alcohol, smoking, also increases your chance of developing cancers.
Wow. So alcohol is also an enemy there.
Yes.
Wow. So at what stage would a woman have to actually begin going for screening for breast cancers?
So
now I will not say women. Sorry about that, women. Now we know that men can also get breast cancer. This is the biggest news on this channel today. Guys, men, be careful. It's not only the ladies that should be checking out themselves. Let's also begin to check, because now we know that men can have breast cancer. So at what stage, when should women actually check for breast cancers?
The hallmark information is know your body. Know your body and go for regular checkups. At least 6 months or every year, see your doctor for regular checkup. One, as a woman, you should, or men, you should equally perform self-breast examination. You should perform monthly self-breast examination. The more you perform the examination, you get to know your body. You get to know if there is a lump in it. You get to know the changes that is occurring overnight. You get to know the shape of the lump. You get to know the location of the lump. So regular self-examination is key. The next one is clinical examination. That's when you go to the hospital for your GP or advanced nurse practitioner to perform the breast examination for you.
Okay.
That one, you lie down, then the person with expert knowledge will perform the examination for you.
Okay.
So with this one, there is no year on it. You can walk in based on your health plan.
Okay.
Go for the checkup. Your doctor will perform the examination for you. Then equally, we have mammogram. The mammogram varies from countries to countries based on the evidence in the country. Some countries support women at the age of 45 going for yearly mammogram, so that they will be able to detect the cancer as early as possible. Some countries promote 50 years upward. You go for the yearly. Some countries support that at least when you go for the mammogram for continuous 3 years and we did not detect any breast cancer, it is good to now extend it to maybe 2 years or 3 years. Then you go for the mammogram, so that you reduce the radiation that you are taking based on the mammogram. So it is good to, based on the location, have a plan with your doctor, so that as early as possible we'll be able to detect the cancer when it starts emerging. Don't stay home and don't think that, oh, I've seen a lump in my breast, so I'm going for herbal treatment. I have seen a lump in my breast, so I'm going to a prophet for a special holy anointing or water to apply. I always say that it is good to have a holistic health care.
Okay.
Praying is good, but seeking advice from your health professional is equally important.
Wow, wow. This is deep. This is deep. So I know you've mentioned a few options for treatment, as in using the radiology, or is that radiation, radiotherapy, and other surgeries and other stuff. So are there side effects to any of them, or?
Okay, thank you very much for that question. No, there are. I always say that cancer is curable if we detect it early, and there are stages in cancer. So somebody may have a stage 1 breast cancer. The treatments will be different from somebody with a stage 2 breast cancer, somebody with a stage 3, and somebody with a stage 4 breast cancer. So the stage 1, stage 2, most of the time they are the early stages of the cancer. Then stage 3, stage 4. Stage 4 is the advanced stage of the cancer. It means likely the cancer has started spreading. If it occurred in the breast, it has started spreading to the spinal cord. It may have spread to the liver. It may have spread to the brain. So it has spread to multiple sites. So that treatment will equally be different. So we have what we call palliative care or end of life care.
Okay.
So we have surgery, we have chemotherapy, we have hormonal therapy, we have radiotherapy. Radiotherapy is when the cancer patient is actually positioned in a specialized machine that produces high energy radiation to just the cancer area, not the entire body. We should know that. Not the entire body. It's just the location of the cancer, and it kills only the cancer cells based on the planning that they have done. You may kill normal cells, but it is not as targeting the cancer cells. So there are side effects to all treatments. There are side effects to all treatment. We know that medical treatment comes with some complications. Any treatment that you are taking, one way or the other. So surgery comes with its side effects. Maybe you had surgery of the breast. You could have a side effect like lymphedema. It could affect the lymph. Then your hand could swelling. So after surgery, you may be kept in the hospital for monitoring and evaluation, so that if side effects set in, the doctors, the nurses that are well trained will address it. And equally, chemotherapy may have side effects like nausea and vomiting. You may have side effects like losing your hair. May set in. But the interesting thing is, even when you lose your hair, after the treatment, the hair comes back.
Oh, really?
Yes, it comes back.
And let me ask this. There is this information. I'm not sure if it's misconception or there's some truth in it. When we see someone who is losing the hair or has lost her hair due to cancer, from where we stand, we think, oh my God, the sickness maybe is getting worse now. She's kind of losing, or he's losing all the hair. The sickness is eating all the hair up. Is it the sickness that gets worse to cause the people to lose their hair, or it's something else?
Okay, thank you for...
Have you heard about that?
Yeah.
Thank you for that question. The truth is the side effect of the treatment the cancer patient is receiving. You know, as I said, cancer is basically starting from the cells, and it is cells that are dividing rapidly without any control. So the cells of the hair equally divide rapidly. They divide rapidly. So when the patient is receiving the chemotherapy is supposed to target the cells that are dividing rapidly. So the chemotherapy sees the cells of the hair like the cancer cells. So it equally attacks the cells of the hair. Then gradually the hair will start falling. Then the patient will lose the hair. Like I said, after treatment, the hair grows back, and it even grows nicer.
Wow.
Yes, it grows nicer. particularly those of us from Africa. When it loses, you start getting better hair, I tell you. So let's give support to patients that are going through treatment. This is the time they need our emotional support, they need psychological support, they need social support, they need physical support, and they need spiritual support.
Hey guys, so you know, if you are going through this and you are losing your hair, or you think you are going to lose your hair, there is hope. You will get it back. So don't worry. You are only saving it like your money in the bank, and it will come with some interest, because he said it's going to come looking even much nicer than before. Our hearts are with anybody that is going through any such thing. We know it's a terrible thing. It's not easy for someone to even emotionally deal with it.
Yes.
You know, but if you are going through it, we are with you. Koda TV, we are still with you. We are reconciling humanity to the source, as in to the maker. And remember, doctor said something that when you get these symptoms, don't just rush for prayer or anything. He does not therefore debunk the potency of prayer. You don't know him. The other side of this man, spiritually, religiously, is another thing. He's on another dimension altogether. So he's not debunking the potency of prayer, but he's making us understand that the holistic approach, is that how you said it?
Yes.
Or at least I'm learning. The holistic approach to cure the situation or to resolve the problem is better. Take your medications, still go, have your prayer sessions. Whatever you believe in. Christians, we encourage Christians to pray. So if you are a Christian, just pray to God, because God will let the efficiency of the medication even work for you. Not many people will take certain tablets and it works for them. So by prayer, Bible says that he has given us the trees and the leaves. We should use the leaves for our medication, and the other part for our food. So God is not even against medication, but as you take your tablets, we put in the prayer, and holistically you'll be cured, and then we'll be better off. Yeah, so doctor, I think viewers may have gathered a lot of information today.
Yes.
And there is more to come. We're going to talk about how you found yourself in Australia to do what you are doing. But before we do that, we will put through, maybe if Sister Margaret has something to ask. When we finish, then you put in your final words in regards to cancer, and then we'll talk about how you made it, because you went to study in London.
Yes,
you've studied in Southampton. You've studied in Australia and
studied in South Africa.
Studied in South Africa. Many people have the potential to also step out of their boundaries, to do more, to learn more. I believe viewers, we trust you. We know what you guys can do. So today, Brother Andrew, as in Dr. Andrew Donko, will give us some tips on how to exit where we are and how to find ourselves wherever we want to find ourselves. Yeah, so Sister Margaret.
Koda TV, reconciling humanity to the source. Stay blessed.